Hi, this is Dr. Kelley from Thrive Wellness Center, and today I thought I would take you through what used to be my healthcare class for new patients. So anytime a new patient started in my practice, they and their family would be invited to this class to hear a little bit more about natural health. So I thought I would go ahead and record this so that other people could listen to it as well. So the topic is wellness for your family naturally. So how do we go about natural health care? I always would start by taking the time to thank people for attending the class, whether it's online, virtually, or in person, because let's face it, everybody's schedule is so hectic, especially if they're trying to get the entire family to come sit in for a class. That can be a little challenging. We're going to talk a little bit about who I am and my background, but before we begin, hopefully you know where your restrooms are if you're listening to this at home. If you have any questions, please feel free to email them to me. I will try to remember to give you my email address at the end of the session. And this class typically would go anywhere between 15 and 30 minutes, depending on how many questions people have. So that about covers this slide. So give you a little bit more about my background. I have been a licensed chiropractor for over 15 years. I've practiced in multiple states, helping people to address health concerns naturally and to achieve a better, more optimal state of health naturally. But the question becomes, what is health and what is healthy and what is wellness and how is one chiropractor different from another? So we're going to be talking a little bit more about those things as we go through. My background also includes a master's in public health, which was a almost two-year postgraduate education in infectious diseases, viruses, bacteria, epidemics, pandemics, and the like. Also have bachelor's degrees in psychology, sociology, and human biology. So lots going on over here at Thrive Wellness Center, but wanted to go ahead and just dive right in. Now, three main questions people have or that we will be discussing tonight. First is, what is health? Next question is, how does the body work, especially as it relates to health? And what is a subluxation or a vertebral subluxation or a subluxation complex or VSC? So we'll be talking about all that tonight as well. Now, in terms of addressing that first question, what is health? Most people think health is feeling good. I mean, I hear it all the time in practice that, oh no, doc, I feel fine. I just have my normal headaches. I just have my daily back pain. I feel great. I just take a handful of medication every day. But a lack of symptoms does not mean that you're healthy. You can go through life and not have a sign or a symptom that you recognize as abnormal. You may chalk it up to something else. So for example, you may have a headache, but I didn't really get a lot of sleep last night, or I'm dehydrated. And it could be those, or it could be a sign of something else, but you don't really pay attention to it because you don't really recognize it as a problem. So therefore, just by not having symptoms doesn't mean that we're healthy. And we've all heard of people, if we haven't known them personally, who went to the doctor for a routine checkup and came out with some horrible diagnosis, cancer, diabetes, fibromyalgia, or they just dropped dead of a heart attack. So we cannot look at how we feel as a good indicator of how healthy we are. So if you look great and you feel good, but you have an undetected disease, there's a pathological process going on inside your body that has not been diagnosed yet, you're sick. And oftentimes people don't really understand. We kind of have that philosophy, if it's not broken, don't fix it. But how do you know if it's broken if all you're looking at are symptoms and our bodies are masters at adapting and kind of getting through our days? So what are some common symptoms? Now we're going to talk about symptoms that occur when people, quote, feel sick. So the first symptom, vomiting, everybody's favorite. So if let's say that we went out to a Chinese food restaurant and instead of the lo mein, we got to mein. So we got food poisoning. Now let's say that you and I both ate the same food, and within a few hours you're feeling terrible, you're vomiting, maybe you've got diarrhea too, and I'm kind of green around the gills, but I don't actually throw up. Who do you think is healthier? Now, being that this is a webinar version, there's not a lot of ability for interaction here. But typically, people in the audience will say one versus the other, and it is kind of a trick question. The healthier person would be the person who's vomiting. And why? Why is the healthier person the one who is, quote, getting sick? It's because their body has recognized, hey, there's something dangerous here, and I need to get rid of it as quickly as possible. That may not be comfortable, but we're getting it out of the body before it can do more damage. So the person who starts vomiting is actually healthier than the person whose body is like, well, I don't feel so great, but I don't really know why, and the body doesn't do anything to get rid of the pathogen. So vomiting. Next common symptom is a fever. We've all had it. And in our culture, what do? Little Johnny has a fever, and we think, oh my goodness, we have to get that temperature down. So we'll do, cold packs, or we'll do some kind of non-steroidal anti-inflammatory. We'll do all these different things to get his fever down. And when his fever is down, we think, whew, we averted a crisis. Little Johnny's going to make it. But the problem with that is that there is a reason why our body spikes the temperature. So most often viruses and bacteria and other bugs, they kind of have an ideal temperature range that they love to live in and hang out in and reproduce in. And that temperature is typically pretty close to 98.6. So every pathogen maybe has a slightly different temperature. Maybe this one is 97.8, 98.6, whatever it is, it's usually pretty close to that, quote, normal range of temperature for humans. And that's how they've adapted to survive and to thrive. So when our body notices this pathogen, it instinctively increases our temperature. It's kind of like if you had company and they stayed too long, I live in the Tampa Bay area now, so imagine it's the middle of August and you have company that stayed a little longer and they're kind of getting on your nerves. You might decide to turn the AC off. And so as the house gets hotter and hotter, the company says, whoa, this isn't so comfy and cozy anymore. I think it might be time to leave. So a similar thing happens in the body. When your body cranks up to temperature, the viruses and bacteria or other bugs, it's not hospitable anymore. So they leave or they die. It's that simple. But in our effort to try to save the day, we've actually left our body more vulnerable to a bigger problem. Now, common sense has to be used with this. If there's a person who has a temperature of 104, 105, 106, obviously that's a different story. If it lasts for a very long time, several hours, several days, different story. But what I'm talking about is a lower grade temp, 100, 101, 102, maybe as high as 103, depending on the other circumstances. But sometimes letting the body run its course with the fever is the best thing you can do for it. And it kind of ties in with, the kind of healthcare that people used to use back before we had healthcare. What would they do? They would stick you in bed with a lot of blankets, or they would put on a mustard plaster on your chest, or they'd stick you in a hot bath. And what do those things do? They raise your temperature. And getting that temperature higher for a short window of time can help, again, make that environment, your internal environment, inhospitable to the pathogen. Coughing, sneezing, again, common symptoms of, quote, being sick, but these are ways your body gets rid of things that are trying to invade the body. We can trap it in our mucus, and then we can cough it up and spit it out, or we can cough it up and swallow it so our stomach acid destroys it. Or we can sneeze it out and propel it as far away from us as we possibly can. So we could go through pretty much every symptom, any symptom in the body, and show how a symptom is simply your body's immune system and your body's innate way of taking care of itself in action. So how you feel is a very poor indication of how healthy you are, because someone who's been exposed to a virus, bacteria, etc., and they start vomiting, diarrhea, fever, coughing, sneezing, that's their healthy immune system trying to take care of their body. And what do? We try and do everything we can to cover up the symptoms because they're not comfortable. So traditional healthcare, again, teaches us to cover up our symptoms. these measures are going to ignore the underlying cause of the sickness by chasing the symptoms. So we're going to get the fever down. We're going to stop the coughing. We're going to address the headache. We're going to stop the diarrhea. And again, common sense, there's a time and a place for everything. If you've got a huge business meeting and your career depends on it and you've got diarrhea, well, of course, take the anti-diarrheal and go be successful at your business. But by kind of covering up those underlying causes of the sickness by just chasing the symptom, we're never really going to be successful. All right, let's take a look at some approaches that traditional healthcare uses to various things. What if we have a migraine headache? What do we do? And again, this is usually an interactive part of the presentation, so it's maybe a little like, okay, well, now what? What do we do with the migraine? Traditionally, we drug it. There's a variety of medications, everything from over-the-counter like Excedrin migraine all the way up to prescription medications. And they actually now are doing steroid injections into neck musculature to help address migraines, into what we call the trigger points or the knots of the muscles. They have also started cauterizing or burning nerves that can trigger migraine headaches. And knowing that eventually they hopefully will grow back. But so those are some more radical approaches. High blood pressure, what do? We drug it. We take that little pill every day for the rest of our lives just so that number on the blood pressure cuff is lower, but we never look at why is your blood pressure high. Especially if that's something relatively new. Why is it high today when it wasn't high 2 years ago? What has changed? Have you put on weight? Are you under more stress? Have you changed your diet? Have you moved location? Have you had a toxic exposure? I've had several patients with high blood pressure over the years, and I've heard some really interesting stories. One patient had high blood pressure being treated with, blood pressure medication for 7 years, only to find out that it was actually a mild infection. It was a bacterial infection in his heart caused by dental bacteria. So the bacteria in his mouth migrated to his heart, had a mild infection of the heart, like a low-grade infection, so he didn't feel terrible. Again, how you feel is a poor indication of how healthy you are. So for 7 years, his blood pressure was elevated, and his body couldn't kick this infection until finally somebody looked and saw that, why does he have high blood pressure? Nobody else in his family has it. He doesn't have a history of it. Well, now we know. Another patient had heavy metal toxicity. They had a career in the paint industry with lots of exposure to heavy metals. They stopped taking the high blood pressure medication and instead did chelation therapy to get rid of the heavy metals in their body. And what do you know? The high blood pressure went away. So there is a time and a place for medication, absolutely, but looking a little deeper for the why behind the symptom is really important. What do we do with a muscle spasm? Well, we drug it, right? We use a muscle relaxant, or maybe we'll do something, maybe a next step up would be something like massage therapy. And as we kind of go up the ladder here, what do we do if there's a part of the body that's not working properly? Any guesses? Any guesses? We cut it out. We don't need it anymore. I guess we were born with spare parts. Not really. We have those parts for a reason. So instead of looking at lifestyle, in the example of a gallbladder, like let's look at the diet, let's look at their exercise, let's look at family history, let's look at nutrients, let's look at the liver. Instead of doing that, we just say, oh, it's not working, let's chop it out. And now what happens is the gallbladder has a purpose, and its purpose is it holds bile, and bile is what we need to help us break down and digest fats. So if we no longer have a gallbladder, our liver still makes the bile, but we don't have a storehouse, like a warehouse of it. So when we eat fatty food, now the liver has to work harder to get the bile out, and it rarely can get out enough, like as much as we need to digest the food that we just ate, because it happens too quickly. So now as a result, we have impaired fat metabolism, we have impaired digestion, impaired absorption, because we cut out this gallbladder. And again, time and a place, but let's be smart about it and figure out why is the problem there to begin with. So optimal health, really, if I were to give a definition, a simple definition, it's how well your body works physically, mentally, and spiritually. It's not just one aspect. We have to look at overall and kind of a holistic view. So how does your body work? In general, very kind of high level, your nervous system controls every function of every muscle, every tissue, every organ, and every cell in your body. Now, I don't know who counted because it was not me, but at last count, they estimate we have between 50 and 70 trillion cells in the human body. That's a 50 or a 70 followed by 12 zeros. And every cell has to be told what to do every single day, every second of every single day. What to do, what not to do, when to do it, how much to do it. So I oftentimes will tell parents it's like having 50 to 70 trillion toddlers running around, and your brain is responsible for corralling and coordinating all of them. Like little Johnny, don't pester your sister. Put that down. Move that up. Move that over there. Put your stuff away. Go to your room. Just nonstop, 24/7, 365 days a year. Nervous system is doing a tremendous amount of activity. So nervous system includes your brain and your spinal cord, but now the next question is, what tells your brain what to do? Again, let's ask that one more question. If the nervous system tells your body what to do, what tells your brain what to do? And that is something that we call innate intelligence. Well, what is that? Innate intelligence is the intelligence that you were born with. The way that I kind of describe it is when conception happens and the sperm and the egg meet, you can almost think of it like a program, right? Like a program in a computer. It just goes. It just starts automatically from some trigger, and it just goes through its process. So when that sperm and that egg combine, there's a process that begins, and there's a, quote, program that starts, and that's what develops a whole new human being. It's pretty amazing. This innate intelligence is what grows a human body. It's what heals your body. It is what runs your body without us having to think about it. And this innate intelligence that you were born with allows you to adapt to your environment and to constantly strive and move towards wellness. Now, if there's no interference to that intelligence, then life, we would say, continues to be expressed at 100%. 100% function, 100% health. But what happens is there's interference. And interference then impacts and decreases the functioning of the body. So what is this interference? There's lots of things that can disrupt the messaging between the brain and the body, which, by the way, those messages are flying around at about 300 miles an hour. For example, the movable bones of the spinal column, known as the vertebra, are commonly at fault. So if they don't have proper motion, or if they are in an incorrect position, that can disrupt or aggravate the delicate nervous tissue, which then alters the messaging to and from or between the brain and the body. Now, by incorrect position, I don't mean inches. I mean millimeters. So just a tiny, tiny amount of rotation or movement or improper position of the spinal bones can irritate that delicate, delicate nervous tissue. And when that tissue is irritated, just like you or I, it doesn't want to work so hard. Now, these misalignments are called subluxations, vertebral subluxations, vertebral subluxation complex, VSC, misalignments. There's lots of different names for them, but again, it's those misalignments that we're looking at that are causing irritation to the nervous system, which then create problems down the path. Now, again, taking it that step back, what causes a subluxation or a misalignment? Now, we can look at this through the lens of looking at 3 types of stress. So I oftentimes will joke that, okay, what causes a subluxation? Well, it's a 6-letter word. It starts with S, but it's not spouse, although it could be if your spouse causes stress. So first dimension of stress is physical. Next is biochemical. And finally, psychological. And we're going to talk about each one of these 3. So physical, biochemical, psychological. Physical dimension of health is how you use or don't use your body. It's movement, it's lack of movement, it's posture, it's sleep and rest. It could be trauma. Being born. Being born is very traumatic, and it doesn't matter if it was C-section or vaginal. Each one has their own set of complications or issues, ramifications for health. So physical dimension, those are the stressors on your body based on how you use it or don't use it. The biochemical dimension includes everything we put into or onto our bodies. So this is supplementation, alcohol, medication. This is the cleaning products we use in our home, our personal care products that we put on our bodies. Do we take proper vitamins and minerals? Do we not? Are we eating organic? Are we well hydrated? So biochemical, everything you put in or on your body. And then psychological, this is the mind-body connection. So oftentimes this includes things like time management and relationships and worry and guilt and fear and all the things that we commonly think of when we think of stress. So those 3 dimensions of health. Now, based on your perception of health, we can go from 100% function to 40 to 60% function very quickly with a spinal misalignment. We tend to notice and address subluxations or misalignments only when they cause a symptom like pain. Ooh, cool sound effect. But if we only address something when there's pain, we are missing the boat. Why? Pain is one of the last symptoms to show up. And when we start addressing it, it's one of the first symptoms to go away. A common or an easy way to think of this is if you've ever known someone with terminal cancer, oftentimes that unrelenting pain was one of the last things to show up. And then it can be, depending on the type of cancer, can be managed or addressed. But that pain oftentimes is one of the last things to show up. So your body's adapting and adapting and adapting until it can't. And then it'll give you a symptom like pain. But once you start to address the problem, the pain can go away pretty quickly, even though the underlying issue is not completely resolved. So by only addressing an issue when there's pain, that means that we can leave old patterns, we can leave the dysfunction to continue to cause damage in the body just because we don't feel it. So again, basing our health on how we feel is not the right way to go. We need to look at function. The other thing I will mention is only about 10% of our nerves actually carry pain signals. The other 90% are concerned with function. So I oftentimes will tell my patients, whatever pain you're feeling right now, that is 10% of the damage that's happening in your body. The other 90% is the problems that are causing this pain can also be causing dysfunction in other organs and systems in your body. So having that kind of old-fashioned approach, this old-fashioned way of thinking, this is how health and vitality over time degrade to become illness and disability. By taking those symptoms that we have and ignoring them, or only addressing them if we have a serious symptom like pain, that's how our health erodes over time and gets worse over time. Now, let's take a little sidestep into what I call the common sense corner. Most people have their teeth checked on a regular basis throughout their lives. Dentists have done a fantastic job educating people about the need for dental hygiene. However, most people can go their entire lives without ever having their spine checked. And your spine houses your nervous system. There's nothing more important in your body. And by the way, you can replace your teeth. You can have several sets of teeth if you like, as long as you want to pay for it. But we cannot replace or transplant our spine or our nervous system. So you only get one, and it is imperative that we take care of it. But most people will go their entire lives without ever having their spine checked. And the teeth and the spinal bones, they're both made of bones. And as I mentioned, teeth are replaceable, the spine is not. I've oftentimes joked over the years that if our spine was on the outside of our body, if it was visible like our teeth are visible, then maybe people would do a better job at taking care of it, because they would be embarrassed cosmetically if people could see the kind of the condition of their spine. But it is very common in practice that somebody will come into my practice 40, 50, 60 years old, and they have never seen a chiropractor before. They have never had a spinal exam before. And that to me is just heartbreaking. It's horrible. So chiropractors are masters of adjusting techniques. We use those to restore balance, peace, and harmony to the body. Now, we're the only doctors that are trained to locate and detect those spinal misalignments, those subluxations. We do that depending on the doctor and the type of technique that they use. Perhaps they locate those subluxations using X-ray or by manual palpation, meaning we use our hands to check things on your body to see where the misalignments are. Sometimes we can use orthopedic neurological tests. Range of motion can help give us some indicators. So we're the only doctors that are trained to locate and identify those spinal misalignments and then use spinal adjustments to reduce those subluxations, to help to retrain the body. Now, I have to say that most of the time people come in and they say, well, I just want to get 1 or 2 adjustments. We get 1 or 2 adjustments, we get you out of pain. Okay, great, you're out of pain. Those misalignments are still there. You just don't feel them anymore. Now, if we lived in a perfect world that had no stress, so no physical stress, no biochemical stress, no psychological stress, I could adjust you one time and you would never have to be adjusted again. Everything would hold perfectly. But we don't live in that world. We live in a very stressful, fast-paced world where our body is constantly having to change and adapt to meet the needs of the environment. When we do that, that means that there are infinite possibilities and room for these misalignments to occur. You add that to the fact that most people have gone decades without getting their spine checked. That means there's been decades of, well, I guess we can call it like a habit. Your posture is a habit, right? There's muscle memory. This is your muscle, your body's normal. And so we have to retrain a new normal, a new position for these joints, these bones, for these muscles to hold things in place. And just like you would never go to a gym and expect to change your physique by going to the gym once a month or twice a year, you're not going to get optimal results by seeing a chiropractor once a month right out the gate. Typically what happens is there is a corrective process where we take you through adjustments, stretches, exercises, nutritional advice, etc., all to get your body into an optimal state where it develops a new normal, and then it's a matter of maintaining that over time. So kind of like when you go to the gym to change your physique, you're going to go multiple times a week until you get to the point that you are happy with. And once you get to that point, then you can back off and you can do maintenance and just go as needed. So chiropractic, massage therapy, acupuncture, all very similar. When you're working naturally with the body, it can take more time. So we use gentle spinal adjustments. There's over 100 different techniques. So if you don't like popping and cracking, don't be alarmed. There's lots of other ways. There's low force, no force, instrument assisted, table assisted, all kinds of different ways to adjust the body. To allow the nervous system to communicate back and forth with the body so it knows, so it can run the body, and the body can heal itself. And adjustments are awesome. I love adjusting kids because they have no preconceived notion. They have no hang-ups about it. They just know that they feel great afterwards, and typically they just laugh all the way through the adjustment. So adjustments are awesome. And okay, I have 6 degrees. I'm pretty smart, if I do say so myself, but even I don't know how many platelets need to go to a paper cut. So if I were to, give myself a paper cut on the palm of my hand, and you were to hold a gun to my head and say, okay, how many platelets need to go for perfect repair of this paper cut? I have no idea. And the smartest doctors on the planet will have no idea. How many red blood cells need to be there, how many white blood cells, and in which order. We have 5 different types. How many of each type do we need? And when do they need to show up? I don't know. But our body knows. Our brain knows how to run our bodies perfectly. We just need to give it the room it needs and get out of the way. And the adjustments help restore that communication. Wellness chiropractic takes all of that a step further to look at the causes of the subluxations. We are looking at the lifestyle patterns and habits that can cause those patterns to begin with. So we're looking again at the physical health, the biochemical health, as well as psychological. So that in a nutshell is the healthcare class that I used to do a couple nights a week for new patients in my practice. I hope that you found the information useful. And I did promise my email address in case you have questions. I apologize it's not on the screen. I thought it would be. But my email address is the abbreviation for doctor. So it's D as in David, R. Then it's my first name, Kelley, which is Kelley. So if you only spell it with one E, I won't get it. At Thrive, just like you see on the screen, THRIV as in Victor, E. Well, WELL, Center, CENTER, center.com. So Dr. Kelley at thrivewellcenter.com. If you have any questions, comments, please feel free to send them my way. Again, this is Dr. Kelley Mulhern from Thrive Wellness Center, where we believe your body is designed to thrive.